Okay, now we're going to demo how to position and parallel for a posterior periapical. Okay, first again, I always want to make sure my machine is on, and I want to set it for whether it's mandibular or maxillary. Okay, so for this I will demo, let's do a mandibular. Okay, because mandibular is where we have to make sure that we move the tongue out of the way sometimes. Okay, so I come over here, I zoom in, I have it set, I zoom in on Cooper. Okay, and so that you can get a better feel for how it looks, I'm going to adjust his head a little bit so that we can get a better look at his mouth there. Okay. Okay, so let's do a posterior periapical, and it's going to be a premolar. Now see if adding the light helps a little bit so you can see a little bit more. Okay, so the first thing you're going to want to do is you're going to make sure that that the elbow is always sticking out. Remember, the elbow goes out of the mouth. Okay, you have the right ring on. You've already checked it to make sure you can see white is right. Okay, you've checked it to make sure it's the correct way. Now we're going to do premolars. Remember, premolars are that area where the curve happens in our mouth, in our dentition. Okay, so again, and every mouth is different. Okay, so you're going to want to automatically want to do it like this, straight like this, parallel again, but it's not going to happen because of the curve. You got to turn it like this sometimes, okay, depending on the mouth. First thing you do again is you have your mannequin open. You're going to move the tongue out of the way, go in at an angle, okay, release the tongue, being very gentle with it, and you're going to bring back the cheek a little bit. Very important. Don't rip it, just gently pull it back, because that's what you would do with people. And here's a little tip. If you have someone open their mouth really wide, it tightens the cheek, so they won't be able to really let you put anything in. You have to have them close down a little bit to soften the cheek so that you can go in there. Okay? Now I know that I'm doing premolars, so as much as I can, and you can see it's not coming out like this because it can't. It's coming out more like this so that it's going parallel. And as much as I can, I'm going to have Cooper bite down and set my bite stave right on the premolars and move this in. Okay? Now I'm going to zoom in so you can see what I just did. And maybe, let's see if I do like this a little bit. It's not going to work. So I'll just have to lift you up and bring you. Sorry, I know it gets a little jumpy, but I want you to be able to see what I'm doing. Okay? From this side. Now, from this side, you can see how it's more towards an angle. Okay? So it's kind of parallel, like this. Here are the teeth, there's a film. It's parallel to what it is, what we're doing. And the premolars, as much as they can, they're the ones biting right there on the bite stave. Okay? Here's how it looks from this side. Okay? Again, I move the tongue out of the way. Okay, so now I bring down my tube head. If I need to move the extension arm to adjust it, then I do that. Now here's the trick. Here's everything. Here's where we always talk about. Let me see if I can get it in here. Actually, I think what I'm going to do is I'm going to bring you around so you can see exactly what I'm talking about from this end, and maybe this will be a better view for you. Okay. Okay, so now what we're doing is, if this bar is hitting here, okay, you can do one of two things. You can either move this ring back some so that it's shorter and then adjust it, or you can simply just turn the tube head around and use this side where you have more room, and then get in a bit closer and adjust it this way. Okay? Okay, that looks good on both sides. Okay, so I'll show you again. So that's this side here. Okay, then we'll walk this way. And it's flushed on that side as well. So again, now I know that both sides are flushed. I know that my film is parallel to the angle of the teeth, and I'm good to take the X-ray because I've already set my control panel and all that good stuff. Okay, so that's with the tongue. If you were doing the upper, the maxillary, you know, just like I said with the anterior example a minute ago, everyone's mouth is different. Sometimes you have a shallow, sometimes you have deep palate. Sometimes there's tori, and you want to be very careful. Okay, you just gotta adjust your rin for the patient. You know the basic principles, what you could do to eliminate overlapping, cone cutting, and all that other errors that come with it. But you just got to make it work. Basically, that's the bottom line: is make it work, because you can't make the patient feel bad because they have tori or their mouth is shallow. So, basic principle: you want to keep it aligned as much as you can. Okay.